for people when they join. So does that make any sense?
Yes, Quentin, it does.
I don't think we should put the African Union anthem, but of course that would be one of the possibilities, but that's a bit too formal.
I think let's just take one more minute to allow a few more people to join.
Yeah.
Okay, I think we can get started.
I've gotten Dr. Ibe. He says that he nominated Simon to join. So Simon is joining. Thank you.
Thank you so much, Lawrence. Marianne, I think we can start.
Yes, I think we should. All right, so hello everyone, welcome, warm welcome to this webinar today. This is part of the Africa Teachers webinar series. It's being hosted, co-organized by UNESCO ICPA. ICPA is the International Institute for Capacity Building in Africa, with sponsorship from the European Union's Regional Teachers Initiative for Africa and the Knowledge and Innovation Exchange Hub, which is a joint partnership between the Global Partnership for Education and the International Development Research Center of Canada, include the African Federation of Teaching Regulatory Authorities, that's AFTRA, and the African Union. Today, we're going to be discussing highlights of the African Union's CESA, that's the Continental Education Strategy for Africa, for the years 2026 through 2035, and the Continental Strategy on Mental Health and Psychosocial Support for Teachers in Africa. These are two new strategies that we feel are very relevant to discuss today, and we'll be hearing experts from various organizations that I've mentioned, and we invite you to also share expertise today. Some of you may know that this is a repeat webinar. It's following the previous webinar on the same topic that was held at the Hybrid AFTRA conference on May 8th. And we are repeating this for the new group and to delve more deeply into the topics. If you attended the other one on May 8th, great. We welcome you back to this one. And we hope that you'll join us as well for the next two webinars in this same series on slightly different topics on African teachers, and those will be on June 3rd and August 7th. If you attend all three of these webinars, so that's today, June 5th, that's July 3rd, and that's August 7th, then you'll receive a digital certificate of participation. Although you have to attend the full timings of the three sessions, We want you to be able to fully participate and join in. So again, if you attend all three, the full times, all 3 dates, then you'll receive a digital certificate to recognize your efforts. I think we can go to the next slide, please, for a couple of housekeeping points. Could we go to the next slide, please? Thank you so much. So I'm speaking in English right now, but if you'd like to hear this webinar in French or Portuguese or another language, any of these 3 languages, if you're tuning in, you need to go to the More button and click on interpretation. So there should be 3 little dots that says More, and you can see the interpretation. And click your language of preference. So interpretation is available in these 3 languages, English, French, Portuguese. Again, please select by going to the More button. We'll type this instruction in the chat box too. After today, the recording of this meeting and the PowerPoint will be made available, and we'll share the link as soon as it's ready. And finally, please use the question and answer box to ask questions throughout this webinar. We hope that it's interactive and that you will post your questions. We'll use them during the question and answer session shortly. So I'd like to, as moderator, call on our first speaker, Mervi Hakoniemi. She's the Knowledge Management Specialist at the European Union's Regional Teachers Initiative for Africa, one of the sponsors of this webinar. Mervi, over to you, please, for open.
Thank you, Marianne. Glad to be here. And good afternoon, everyone. As mentioned by Marianne, my name is Mervi Hakoniemi. I am the Knowledge Management Specialist for the Regional Teachers Initiative for Africa, or RTIA. RTIA addresses the shortage of qualified teachers in sub-Saharan Africa by supporting teacher education and professional development. And this is a partnership between European Union member states, Belgium, France, Finland, UNESCO, and the African Union Commission, and funded by the European Commission through the Global Gateway Strategy. I am pleased to warmly welcome you to this 4th webinar of the Africa Teachers webinar series. And as mentioned already, this time we explore the Continental Education Strategy for Africa 2026-2035, or CESA, and the Continental Strategy for Mental Health and Psychosocial Support for Teachers in Africa. And as mentioned, this is repetition from the presentation of CESA, which was already done during the AFTRA conference this May 8th. But due to some technical issues, we are now repeating it to give everybody the chance to listen to these important speeches that we have. The CESA emphasizes holistic skills development from foundational to socio-emotional and labor market competencies. And it also highlights the vital role of teachers in improving learning outcomes. At the RTIA, teachers are also our focus. We contribute through demand-driven technical assistance on governance, through innovative teacher training initiatives, and through creation and sharing of knowledge. And these themes are also at the heart of us in this monthly webinar series, which is jointly organized by different organizations and partners, by the RTIA, by the Global Partnership for Education Knowledge and Innovation Exchange, GPE KICS, in joint endeavor with the International Development Research Centre Canada, by the Africa Federation of Teaching Regulatory Authorities, by the African Union, and UNESCO ICPA. And more information on this webinar series can be found from the UNESCO ICPA website, which also provides the registration links for the following webinars. Without further ado, I would like to sincerely thank you all for participating, also all our partners and sponsors for the continued support. And I would like to give the word to the first speaker. Thank you.
Murphy, thank you so much for that warm and informative introduction. I think now we can move to our keynote address. So I'd like to call on Ms. Sophia Ashapala. She's the head for education at the African Union Commission, to say a few words. Over to you, Sophia. You have 10 minutes.
Thank you very much, moderator, and a very good afternoon, good morning, good evening, wherever you are joining us from across Africa and beyond, dear esteemed educators, partners, and friends of education. Indeed, it's both an honor and a privilege to address you at this critical moment in Africa education journey as we pre-launch the Continental Education Strategy for Africa, which is known as CESA 2026 to 3035, as well as the Continental Strategy on Mental Health and Psychosocial Support for Teachers in Africa. Today's occasion is more than a formal unveiling. It is a call to action, a moment of reflection, and a shared commitment to placing people, particularly our teachers, at the heart of Africa education transformation. CESA 2026 to 3035, we know that it builds upon the foundation which has been laid by CESA 16 to 25. It is a compass for our collective aspiration to transform education and training system across Africa. It reaffirms our vision of an integrated, peaceful, prosperous Africa, which is driven by its citizens and representing a dynamic force in a global arena. This new decade of CESA emphasizes resilience, relevance, equity, and inclusion. But no matter how bold our strategy or how ambitious our policies are, there is one undeniable truth. Education only thrives when its teachers thrive. We know that teachers are the backbone of our education system. They are the nation builders. They are the mentors, the innovators, the caregivers, and most often unsung heroes. Yet, in too many parts of our continent, teachers carry out these roles under immense pressure, burdened by overcrowded classrooms, limited resources, insufficient training, low wages, and increasingly unaddressed mental health challenges. Today, ladies and gentlemen, with the pre-launch of this strategy, the Continental Strategy on Mental Health and Psychosocial Support for Teachers, we confront these realities head-on. We acknowledge that teachers' well-being is not a luxury, it is a necessity. It is the integral to effective learning, to retaining and to motivating teachers, and to building a safe and inclusive school environment for all learners. Recent research and reports from across our member states reveal a sobering picture: rising rates of burnout, stress, anxiety, and depression among educators, which is exacerbated by COVID-19 pandemic, prolonged conflict, displacement, and socioeconomic instability. And yet, mental health remains one of the most neglected dimensions of educational policy. This strategy is therefore a milestone. It is the first continental effort to recognize, to support, and to institutionalize mental health and psychosocial well-being in the teaching profession. It calls upon all governments, civil society, teachers' union, development partners, and academic institutions to act holistically in addressing these issues. Therefore, as we begin this webinar, I urge us all to reflect on a few guiding questions. What does it truly mean to care for those who care for our children? How can we move beyond bombast to concrete policy actions and budget allocations? What roles can innovation community engagement, and traditional African knowledge play in healing and supporting our educators? Today, ladies and gentlemen, you will hear from experts and champions who are pioneering models of psychosocial support, including pedagogy and trauma-informed education. Let's therefore listen, let us challenge our assumptions, and let us co-create solutions. The African Union stands ready to work with all the stakeholders to implement this dual vision: quality inclusive education through the Continental Strategy for Africa, and a compassionate, responsive system of support for teachers through our mental health strategy. Let us commit today with agency, empathy to build a continent where every teacher is supported, every classroom is a space of healing and hope, and every learner can flourish. Let us therefore engage, let's collaborate and transform together. Thank you very much.
Sophia, thank you so much for those inspiring remarks. Quite relevant, quite stirring. And we'd like to now move on to our first presentation for today as we start to delve into the new CESA strategy, and then moving on to mental health for teachers a bit later in this webinar. So we're going to hear from Dr. Quentin Woden now. He's the director of UNESCO ICPA. And again, ICPA is the International Institute for Capacity Building in Africa. Over to you, Quentin.
Thank you, Mariam. I hope that you can hear me. So indeed, the way we structured the webinar, I'll provide a few technical comments on the new CESA of the African Union. And then my colleague Luca will present the mental health strategy. And one of the key elements that ministries or teacher service commissions or teacher councils need to improve mental health among teachers is first to know how well they are doing. And so we'll have two country presentations on that from Zambia and from Ghana. But let me start with the rapid commentary on CESA. And the idea was to suggest 10 things that are slightly new or different with the new CESA in comparison to the previous CESA that was implemented from 2015 to 2025. We can go to the next slide, Camelia. So first, my assumption is that many of you have not seen this presentation. You were not at the AFTRA meeting for most of you, and you may not have participated in some of the consultations that were held. But the African Union did a major effort to have broad consultations when preparing the CESA. Different events took place. The first one was at the AFTRA annual conference of last year, and a few others later with over 2,500 participants. 12 different surveys in both English and French were implemented with 1,700 respondents. There was a technical consultation meeting that was also well attended. This went to the specialized technical committee of the African Union. And finally, the CESA was adopted at the summit in February. And the African Union is finalizing the document. It should be available relatively soon on their website. Next slide. So the first step that was taken was to assess how well the previous CESA was known and implemented. And there were 7 main conclusions, and I'm going to go very quickly through them. There was a good awareness of the previous CESA, but a limited actual use of the strategy. The strategy was considered useful, but in part because of limited use, it had limited impact in countries. There were important objectives. So essentially all of the objectives from the previous CESA were considered important. But when countries were asked or when people commented on the progress towards those objectives, as you all know, progress has been fairly limited over the last 10 years. One concern was that the monitoring framework was much too complex, many indicators that could not be actually measured. and this was a suggestion then for the next CESA, the current one, just approved, to have a simpler monitoring framework. The governance framework was very ambitious and not fully implemented. And one of the key mechanisms that the African Union used for implementing the previous CESA was what was called CESA clusters. These are formal, informal, it's a bit in between mechanisms with 12 different themes, that's 12 different clusters, where organizations working on a particular theme could meet together with the African Union and brainstorm on ideas. For example, there is one cluster on teacher professional development that is led by AFTRA and Education International, and for which IGBA serves as the secretariat. In terms of constraints for implementation, the two main constraints were the lack of awareness, because of course, if you don't know the strategy, you cannot implement it, but also a lack of budget funding, not surprising, both at the level of the African Union and at the level of countries. And this is likely to remain a serious constraint even for the current CESA. Next slide. So the CESA includes a brief investment case. I'm not going to go in details through this slide, but the basic idea is that this is a core document for the African Union. And of course, many of the people who will read it are working in education. But for the people who are not in education, it might be useful to remind them of the huge importance of education for countries' development. And that's what that investment case does. Next slide. The structure of the new CESA is along 6 strategic areas and 20 objectives. Now, the only message of this slide here is to say that the choice was made not to have a long list of actions recommended in the CESA, but rather to provide a broader framework for guidance. And so you will not have in the CESA itself, for example, for each objective, you should do A, B, C, D, E. But rather, this is an important objective. These are some of the guidance that exist on how to improve educational outcomes in that area. Now, one of the constraints of any documents like the CESA, even if the current one for the next 10 years is longer as a document than the previous one, is that it's very difficult to go in depth in anything because it covers all of the countries, the whole education sector from pre-primary to tertiary and also lifelong learning. And so the idea will be to produce a series of companion papers in key areas. These are likely to then be vetted by the clusters that I mentioned, the CESA clusters. And in the case of teachers, since this is the Africa teacher webinar series, the idea would be to prepare one companion paper for each of the 3 main objectives of CESA that I'm going to go to for teachers. Next slide. So we are now going into the core. You have a visualization on the right. We can share those slides with you. They will be shared actually right after the webinar is posted on the web at YouTube, I think. And what the slide shows essentially is the 6 strategic areas with 2 foundations. First, the resources and the enabling environment, then the teachers, as we just mentioned, then 3 main objectives from pre-primary to secondary education, which are related to different types of skills that individuals need to acquire. Then we go to higher education and TVET, second chance programs for those who dropped out of school and lifelong learning. And finally, an overarching objective of gender equity and inclusion that is meant to permeate the whole CESA. There's also at the bottom a mention of some mega trends. Perhaps we can go through those in the Q&A. But let me go next slide, starting to present to you the various objectives of the CESA. So I'm not going to go through all 6 areas. I'm going to select a few. So first, teachers, educators, and caregivers. This has an even stronger emphasis in this strategy than it was in the CESA from 2016 to 2025. And there are 3 objectives, and if you see them, and again, I assume that many of you have not seen that before, you can see that the first one is very broad: improve teacher policies, education, and professional development, so both pre-service and in-service. The second one is a bit more narrow: increasing the attractiveness of the teaching profession. So there's often a discussion of salaries. Salaries, of course, matter, but many governments have a very limited fiscal space to improve salaries. But there are many other things that matter for the attractiveness of the teaching profession. And one that we will discuss more in depth today is the issue of mental health. And that's why the African Union adopted also with CESA a strategy on mental health for teachers. And finally, the last of the three objectives for teachers is a bit more narrow still, but it's to recognize the very specific importance of school leadership. When you ask actually teachers, what is one of the main reasons why you are staying in the profession as a teacher, often the issue of good school leadership comes up right near the top. We see that in some of the surveys we are implementing. Another key message that we wanted to highlight is the importance of increasing the share of female school leaders. Now, in some countries, very few, in Africa, there's a majority of female school leaders, but in most countries, school leaders are mostly men. And we can see in the data that when you have female school leaders, this actually improves learning for the children, and there are some very specific reasons why that we could discuss in the Q&A if you are interested. Next slide. The stronger emphasis also in this new CESA on skills, and here the idea is to consider pre-primary to secondary, including foundational literacy and numeracy. So the first objective among the three objectives for basic education is to expand cost-effective approaches to early childhood education and foundational learning. I mean, frankly, if the children are not able to read and write and do simple math, simple arithmetics, it's going to be very difficult for them to progress later in their studies at the secondary level and ultimately at the tertiary level. There's a huge learning crisis, as you know, in Africa. Some estimates suggest that 80–90% of 10-year-old children cannot read and understand a simple text. And there is quite a bit of good guidance that has come up in the last 2–3 years about cost-effective ways to improve learning in primary school, essentially, right? And of course, the importance also of pre-primary education. The next objectives are social-emotional skills, education for health and well-being, and then labor market demands, making education much more relevant for the labor market, including at the secondary and tertiary levels. This applies to TVET, but it also applies to many other areas. And one last thing that I wanted to mention here, although it's not on the slide, is that there is a lot of evidence that suggests the benefits of education. And some of the evidence, we did a recent study at IGBA, suggests that the benefits of literacy are actually higher for wages than the benefits of completing primary school. And so that suggests that primary school is often not very good. It also suggests the importance of investing in literacy, numeracy, and all those foundational skills, plus the others that are mentioned on this slide. The next slide. The next slide is about the last point in terms of the objectives, I think, in the presentation. It is a stronger emphasis on out-of-school children and lifelong learning. The previous CESA had some of that, especially lifelong learning. Adult literacy was emphasized in the previous CESA. Here, there's a stronger emphasis on second chance programs for out-of-school children and youth. And again, this is one area where over the last few years, we have learned a lot about what actually works for girls, for boys, and how to make this also cost effective. As you probably know, the number of out-of-school children in Africa continues to increase. Even though the share may slightly decrease, that depends on which year you compare, but certainly the total number increases, and this should be a key objective at the African Union level, but also in countries. And many countries are now also starting to adopt specific strategies for out-of-school children, how to provide them skills for the labor market, or what is even better when feasible, how to provide accelerated learning programs for these kids to go back to school. Next slide. So this slide, and I realize that it may be a bit small, so I don't know whether you can see it well on the screen, is about the implementation structure. So the idea is that there would be a CESA steering committee at the ministerial level. There would be an operational committee, and then that operational committee would have 5 subcommittees, call them that way, on resource mobilization, implementation, monitoring and reporting, which matters a lot, communications and advocacy, and then, of course, research and knowledge. Now, one of the priorities for the next 6 months, since we have 6 months before 2026, is to prepare an implementation plan, which the African Union is doing. There was a recent meeting in Nairobi to start that work, and also to try to communicate about the new CESA, when it's going to be available on the web, which should be in a matter of weeks. We can start to promote it. There would be different resources, infographics, small manuals, and so on, to make it really user-friendly for different constituencies. And as teachers, we would certainly want to have one document that could be useful for teachers to understand what does the CESA suggest that can be useful to them. Next slide. That's the last slide among the top 10 comments, right, that I wanted to provide. And it's a reminder of the need to have a much simpler M&E framework. This table is a bit complicated. It is in the CESA review that helped inform the new CESA. But basically, the message of the table is that the previous monitoring framework was too complicated. There were a large number of indicators, and data was available for more than 30% of the countries for less than 40% of the indicators, right? So basically, if you had for all of the indicators in all of the countries a table that shows what's available for monitoring, most of the cells would be blank. There is no data. And this means that it's going to be very important to have a simple M&E framework for the next CESA. Next slide. I think I'm done, but let me see if there is one more. No, this is it. I hope I didn't take too much time. I think I had about 15 minutes. So there are some fundamental differences between this CESA and the previous CESA. It's more detailed. It has fewer objectives. It aims to have a more simple implementation framework. But really, the work is just starting. And through the CESA cluster, some of you are members of those, as well as other means, what we need to do is to make it well known, and then start to provide even more detailed guidance on those 20 objectives. And if you're interested in contributing to that, you can contact the African Union, you can contact TIGBA. We are just supporting the African Union in this work, like other organizations are doing. And we hope that we will have your support for implementation. Thank you.
Quentin, thank you so much. And that was exactly 15 minutes when you finished your slides. So excellent job with the time and also with the points too. The 10 points in your presentation, the review of the previous CESA and the need for the new, and some highlights from the new CESA. Can I take this moment to encourage participants to please ask questions in the chat box? We haven't seen a lot of questions yet, and we're really getting into the nitty-gritty details now of the strategies. So please do feel free to post maybe any connections from your own countries and departments and organizations, any observations that you have, any questions. There's a lot of information and we want to hear where you're coming in from. So next we're going to shift gears a little bit to talk about mental health for teachers. So there's a new continental strategy on mental health and psychosocial support for teachers in Africa that's been spearheaded by UNESCO ICPA. And Lucas Halimana will tell us more about that. He's a project officer at ICPA. Over to you, Lucas.
Thank you very much, Marian, and good afternoon, our virtual delegates. It's a pleasure and honor to be given the opportunity to take you through the Continental Strategy on Mental Health and Psychosocial Support for Teachers in Africa. This is African Union Commission work that was produced through the Teacher Development Cluster, of which ICPA is the Secretariat, and you have AFRA and Education International co-chairing that cluster. So it has been very rewarding to engage with all stakeholders, key stakeholders, during consultations, as mentioned by my director there, to gather enough evidence and information and practical guides in terms of how to come up with this continental strategy on mental health and psychosocial support for teachers. So we hope that this document reflects your inputs and contributions, and that you'll be inspired to take it through via implementation. We have lots of policy documents, but implementation remains a challenge. We want to do things differently this time around. Just looking at the cover page there, you realize some of the challenges that our teachers go through. That some of them have been mentioned. There you can see a bit of the heavy workload. Most of our countries are now implementing competence-based curricula, and we want teachers to be giving lots and lots of projects and assignments to our learners, but the work may be overwhelming given the number of the class sizes that some of our teachers have. Next slide, please. You can go to the next one. Go to the next slide. Yes. So why this strategy and why now? We looked through a number of reports, institutional reports, country level reports, systematic reviews, meta-analysis. We have the evidence. We also consulted teachers directly, and we got testimonials in terms of what they were going through. A lot of this work is anchored on our experiences with COVID-19. And I think we all have our own personal accounts in terms of how that affected our mental health and well-being, the isolation, the extended school closures, and the need for us to continue with education under very difficult circumstances where we did not have the necessary ICT infrastructure to actually connect with our learners and provide the necessary education. So during that period, we actually undertook some studies, and a number of countries in sub-Saharan Africa participated. And the report told us that 1 in 3 teachers were reporting depression during the COVID period. Other more research that we have looked into point to teacher burnout and teaching as one of the most difficult profession compared to others. I think there are more teachers who report burnouts compared to other professions for a number of reasons, and most of which have been highlighted already. When you factor in the context of conflicts, post-conflict environments, emergence, humanitarian context, you actually find that the situation of mental health and teacher well-being is more pronounced there because of the nature of the context in those environments where there's displacement, there's violence, and so forth. So, and these things are happening in our continent. A number of our countries, we are hosting refugees and also sources of also going through conflict situations. However, the same research tells us that when teachers feel mentally and emotionally supported, they are more likely to remain motivated and committed to their profession, which tends to reduce teacher burnouts. We also know that teachers, when they still endure trauma, yet they are committed to the profession. So the best we can do is to support them, to provide the skills and competencies that inspires them to continue with the beautiful work that they are doing. Next slide, please. The Continental Strategy on Mental Health and Psychosocial Support is anchored on the CESA 2026 to 2035. So the vision is aligned there. We want actually to achieve, to build a resilient education system for increased access to inclusive, lifelong, quality, and relevant learning in Africa. And as highlighted, I will not repeat the CESA objectives, The three highlighted that you are seeing on the screen contains teachers, and I think teacher mental health or well-being cuts across all those three, but it's more pronounced on the attractiveness of the teaching profession, because a lot of our teachers, experienced teachers, are leaving, exiting the profession for a number of reasons, including the burnout and stress within the profession. Next. What are the core principles? You will find that in the document, it highlights a number of core principles that are guiding the strategy. And I'll just highlight the main ones. The first one being well-being at the core of educational interventions, supporting overall health, resilience, and professional fulfillment. Many of you will recall at the height of the HIV and AIDS epidemic, there were specific policies, programs, interventions that were targeting teachers for their own benefit, because they were equally affected and infected by the virus. And we wanted to ensure that they survive, they live, remain healthy, and are able to deliver quality education to our learners. The same goes here. We are looking at the teacher as an individual so that they are able to live a healthy, happy life. And when they are happy, the classroom is happy, and there are better learning outcomes for our children. So that is the core, one of the core principles, targeting the teacher as an individual to ensure that we actually address their needs as far as mental health and psychosocial well-being is concerned. We want to ensure inclusivity and equity, to ensure that every teacher receives support regardless of where they are, could be by geography, by gender, or any other factors. No teacher should be left behind. So this is a call to ensure that we are inclusive, including disability, of course, and some of these issues we almost forget when we are doing our programs. Cultural relevance and sensitivity. This is very important for us. We need to adapt and contextualize solutions on mental health and well-being to the African context. I give here an example of Ubuntu philosophy and how it may contribute positively to mental health. There are a number of research studies that have been produced on the Ubuntu philosophy. I am because we are. That sense of community is very important when you are dealing with mental health issues. And it is very important for us to reinforce those philosophies of who we are. And that way we'll be able to achieve our results. And of course, we need to embed mental health and psychosocial support into national education policies, curricula, and programs to ensure that it's not a standalone program, but part of the education system and the response to the needs of our teachers. Next. Now, if you have to remember anything about the strategy, this is the core, the summary of what this strategy is calling you to do. At the base, this pyramid is adapted from a number of intervention on mental health and psychosocial support, especially from the humanitarian sector, as developed by the Interagency Standing Committee. So we adapted these pyramids for this strategy for teachers. So at the base, you have enabling environment. So the things that are talked about in the CESA strategy in terms of addressing teacher issues, the policies, the reports, for instance, the Secretary General's recommendations on the status of the teachers, the ILO, UNESCO recommendations, 1966 recommendations, a lot. There are a number of global and regional and national policy documents that calls us to improve the status of the teaching profession. By so doing, we will be addressing mental health and teacher well-being. More directly, we want, of course, policies that address directly this problem of mental health and psychosocial support. We want from the beginning to ensure that we are collaborating, because education cannot do it alone when it comes to mental health. We need other partners, we need other sectors to be part of the coordinated response. So we need to ensure that from the beginning, we bring in strategic partners who have the experience and the technical support to help us. So setting the framework for us to implement effective programs for our teachers. The second layer looks at directly training teachers and community sensitization. That's where we are building the skills and the competencies to ensure that teachers are able to help themselves and help their peers when they are going through problems. They're able to identify that indeed I have a challenge and they're able to seek for help. It is important also to embed community sensitization because we know in many contexts, there's a lot of stigma associated with mental health. The third layer is looking at school level or school-based interventions, making sure that there are deliberate programs targeting teachers and benefiting teachers at the school level, and that teachers are supporting each other to overcome the challenges that they are facing. And when there are serious health problems, mental health conditions that need specialist support, the last layer is talking about specialized care and reintegration. That's where you are referred to a psychiatrist, a psychologist, or the clinicians who are responsible for taking care of patients when they have a mental health conditions. But it doesn't end there. We want to ensure that when the teacher who has exhibited those health conditions is attended to by professionals, they are able to come back and be reintegrated back into the school system and continue delivering their work. Next. Governance and implementation, I think basically the director has already talked a lot around this, how this work is structured. It takes the same format as the one that is articulated in the CESA. We have the AUC who have come up with this strategy leading in terms of political will. We like this because we saw in February, heads of states actually approving these documents so that the political will and leadership that we expect from the AU, but we are also working with the regional economic communities from the different sub-regions, SADC, ECOWAS, EAC, IGAD, and a lot more to really then support member states closely in terms of adapting and making sure that there is experience sharing among member states to learn from each other so that we have solid evidence-based interventions at the country level. And member states, there are so many actors within the member states, Ministry of Education, Ministry of Health, teachers unions, development partners, UN agencies, everyone is called upon to actually contribute and lead the implementation of the programs. The same goes for civil society and private sector partners, academic and higher education partners. We need more research to understand the pathways and how the risk factors associated with mental health in the education sector. So we call upon academics and higher education partners to work with us in doing a lot more research to understand the issues and to come up with evidence-based interventions. Next. Next slide. Monitoring. So one of the key challenges associated with this new strategy is that you find that while some interventions are already captured under Sustainable Development Goal 4, mental health is not explicitly mentioned there. So we'll have to develop new indicators. We have to develop new monitoring and evaluation framework that has specific indicators to be tracked by member states. And here we provide a few examples of those kinds of indicators that can be tracked to monitor progress in the implementation of this strategy. The share of member states with country strategies or guidance notes on mental health and psychosocial support for teachers, including appropriate policies and costed plans, improved knowledge, attitudes, and skills related to mental health and psychosocial support among teachers. So this will be surveys that we undertake to actually measure the knowledge and the attitudes based on the interventions that you have rolled out. And the share of schools with mental health and psychosocial support interventions, including prevention, management, and effective linkages to specialized services using a multi-sectoral approach. And lastly, the share of countries that integrate mental health and psychosocial support content in pre-service training, curriculum, and in-service teacher professional development. So these are some of the examples of some indicators that we can track at country level to ensure that we implement programs that achieve results. Next.
Sorry, Lucas, you have 1 minute left.
Yeah, I think this is more or less the last slide. So what do we aim to achieve after all is done? Reduce burnouts and stress among teachers. So we want happier and healthier teachers. And we know that happier and healthier teachers improved learning environments, and we have better learning outcomes as a result. We want higher retention rates in the profession. We don't want to invest in training teachers who then within no time leave the profession for other greener pastures. We want to ensure that we incentivize our teachers, we support our teachers to do the best that they can for our nations. I think there's no argument about the significance of the teacher as a single variable in the education system. So we need to actually walk the talk, ensuring that we support the teacher. I will stop here and thank you for listening. I'm available to engage more in terms of questions arising. Thank you.
Thank you, Lucas. And indeed, we have quite a few questions that are arising in the chat box. So thank you to those who are asking questions, and please continue to do so. Something that I appreciated from your presentation, Lucas, was the pyramid in which you showed that mental health and psychosocial support for teachers rests on the bedrock of policies, a multi-sectoral coordinating environment, and an enabling and willing national environment. And only on that bedrock can we then move on to normalizing training for teachers, community sensitization, and having specialized mental health care and school-based interventions at the top, where it's more effective for teachers on a daily basis. So thank you for that. I think now we're moving well with our program. We're pretty much on time, but I'd like to now invite Dr. Ebi Mobanga. He's to go next to talk about teacher well-being through survey results in Zambia. Dr. Ebi Mobanga is the acting president of AFTRA and the registrar of the Teaching Council of Zambia. Dr. Ebi, I'm not sure if I see your name coming up. Would you be able to perhaps raise your hand if you're with us so we can identify you and unmute you? Dr. Ebi Mobanga?
Maria, I believe it's Simon who's representing Dr. Ebi.
Okay.
Simon, if you could raise your hand.
Oops. Hello, Simon. Are you with us? Could you raise your hand so we could identify you and unmute you?
Yes.
Yes, we see you.
Yes.
Thank you. Please go ahead.
Thank you so much. Representing Dr. Ebi Mobanga, I'm Simon Mwamba from Teaching Council of Zambia. And I'll run through the findings of the survey that was conducted in Zambia sometime last year on teacher job satisfaction. And the slide is right before you. That is the survey that was conducted in Zambia. The background characteristics of the respondents. We had about 3,946 respondents. And from there, you see that a number of our respondents were teachers. Those are primary school teachers and secondary school teachers. And we had about 37 or so who are school leaders, categorized as head of institutions, directors and principals. We also had deputies and also senior teachers. But we also have school type, giving in the background the characteristics. The two types of schools that we had were public schools and private schools. But you can see already that private schools were just about 1.4%, meaning the majority of the respondents were from public schools. And we also have school location in our case here in Zambia. We have urban schools, we have peri-urban schools, which are semi-urban schools, and we also have rural and remote area schools. We add school levels as well, as it is shown there. You can already see that we have these school levels, and we have primary schools, so we have secondary schools, and those are some of the areas where we got a number of our respondents. We also had categories of our respondents categorized by gender. We had males and females also as our characteristic that we wanted to know were these that were responding to our survey that was conducted. This survey was conducted online, and we are glad that a number of our respondents were coming from the rural part of our country, and which is not very, very easy in terms of connectivity, but these came through and responded to this survey. I think we can move. The next slide. So as we can see, we had to also get information concerning the career plans of our respondents. For the next 5 years, we had responses of those that were saying they were about to retire in the next 5 years, and that is about 6.2 of our respondents who said that they were about to retire. And so the other one, we have about 4.1 who had plans to leave the profession due to the reasons known by themselves, but mainly in trying to establish their own businesses as they leave the profession. We also had 5.4 who indicated that they would like to leave the education profession and enter a new career. Meaning these are teachers currently, but they would want to go into other careers. In our case here in Zambia, we have teachers that have transformed and are now lawyers, are now medical practitioners, and other careers that are available in the country. So we also had a big number who said they would want to move into the administration positions, into school leadership. These were about 46.2. And another one that about 38.1 who said they would want to continue teaching as teachers. And these are the categories that we had in terms of career plans for the next 5 years. Class size, we see it there also that we have our teachers handling different class sizes. The ones that are handling a fewer number of practitioners, you'll find that the majority of such could be coming from private schools. But here we have those that have less than 25 in terms of learners. Number of learners are 5.4. Then we have those that are handling learners between 25 to 34, 10.7. The majority are handling learners over 54. In our situation currently with free education, one could be handling in public schools even around the 120, even above that, above 120. Because free education that was declared after 2021 saw a number of school-aged children who were out of school coming into schools, and that made the class sizes of many public schools to swell up. This is what we got as the responses from our respondents. Unable to see this, okay? Okay, number of lessons per week. Maybe we go back. Number of lessons per week. We have different number of lessons being handled by our teachers. We have those that are handling 11 and below. We are at about 13.2% of the respondents. And the graph goes on. We have 11 to 15, about 16.5. And we have 16 to 20, about 22.1. That is the highest number in terms of the percentage of those that are handling lessons from 16 to 20 per week. But we also have a worrisome situation when you get to those that are handling between 31 to 35 and above 36. We have 10.7. And surely this is something that those that are managing these institutions can look into and try to balance up. Because we have as low as those that are handling 11, less than 11, but also depending on the subjects. So the ones that are managing these institutions should be able to look into these issues and be able to move staff to where there are very few staff and they're handling more lessons per week. I think we can move to the next slide. Teacher job satisfaction, as we got the responses from our teachers and administrators, the perceptions on their job satisfaction, this is what we got. We had those that the deep green is representing strongly agree. There's a light green, lighter than the first one, which is agree. Then we have yellow, disagree, and strongly disagree. So we had questions around given another opportunity, I would still choose teaching as my career. So we had about 24% that agreed to that, and about 49 that agreed, but we still had a number like 18% that disagree and strongly disagree at 8. That number together, put together, you have about 26 that disagreed. And we also had teaching makes my life more meaningful. We had a question around that, and we had 24 again agreed, and we had 63 also agree, strongly agree, 24, 63 agree. And we had the 10 and I think 8 somewhere there, and 4, sorry, who strongly disagreed. So these are some of the questions that we had. My job, the next one was my job. The question around my job allows me to easily meet my family needs. We also had those results coming out. Achievement of set guidelines on promotion is difficulty. We had questions around that, and those are the percentages that came out. I am satisfied with guidelines on promotion. We had questions around that, and those are the results. 9% strongly agreed, and 50% agreed. Then we had those that disagreed. My employer offers many opportunities for career or professional development. We had respondents giving us those percentages. My composition is highly rewarding. We also had questions around that predictor, and we got the results as given by those percentages. I am highly satisfied by my job teaching, by my teaching job. We had 29% strongly agree and 54 agreed, then 12 and 4% disagreed. So these are the results that we got from our respondents. So less than 1/2 of the teachers in Zambia are happy with their job compensation. That is what we are saying. Nevertheless, a vast majority, about 83, agree or strongly agree to be highly satisfied with their job. So this is what we got as the results from the survey on perception of our teachers on their job satisfaction. We can move to the next slide. We can move to the next slide. Hello? We can move, okay. So when you look at this slide, you have some potential predictors of job satisfaction. And so we had a number of questions coined around these predictors. We had questions around the pre-service training, career plans. I think we've already referred to that one. Compensation, CPD opportunities, promotion guidelines, meeting family needs, and career choices. And the questions that were set around these predictors believed that they would give us responses that would show the level of our teachers' job satisfactions in Zambia. We can move to the next slide. Teacher well-being issues. Available mechanism to support teachers on well-being issues. The questions were also set around this issue. For example, we had the questions around the professional services, such as counselors. And we had teachers responding to this, available and not available. So in this question, in Zambia, we received responses. About 45% were saying professional services such as counselors were available. Then we had about 55 who saying they were not available in their schools, where they are based, where they are found. Therefore, when there are severe cases, about 42 said they were available. They could refer when there are the severe cases, and 58 said not available. A common room for relaxation and socialization, 34 said these were available, and 66 said this was not available in their schools, of course. Written guidelines on teacher mental health and well-being at my school. About 22 acknowledged that these guidelines were available, and 78 said they were not available. Free training on issues related to mental health and well-being, we had 17 saying free training on issues related to mental health and well-being was available at their institution, and 83 said none available. We can move to the next slide. Some strategies being used by teachers to avoid work-related stress, setting work boundaries. We have never or rarely, and sometimes, and most of all, or other times. So we, on this issue, we had questions also around these pointers that we have here. For setting work boundaries, we had 10% saying these never or rarely, they rarely used to set work boundaries, and 70% said sometimes they could set work boundaries, and also 70% said most of the times or all the times. Socialization with co-workers, 8% said never or rare. And we also see that 66 said sometimes, and also 66% said most of the times. Reaching out to people close to you, we also have those results coming through. Eating a health meal or healthy diet, we have 15% saying rare or never, 52% saying sometimes, and 52% saying most of the times. We also had the making time to relax, 19% said never, and 36 said sometimes and most of the times. Seeking professional support, we had a big number, 39% saying they never or rarely, and 22% said most of the times and sometimes. This is the results that we got. So about 4% in every 10 teachers in Zambia reported not seeking professional support to deal with work-related stress. This is a worrisome situation, and it calls for intervention by our school managers and policymakers as well. We can move to the next slide.
Sorry, Simon, we're a little over time. Could you try to wrap up in 1 minute? Thank you.
Right. Thank you. Level of participation in service courses on mental health and psychosocial support and well-being, we had 26%, about 1/4 of the teachers reported participating in courses on mental health and well-being issues in the last 3 years, meaning a bigger number has not been able to participate. We can move. We can move. Okay, so support to learner mental health issues. We have those percentages agree and disagree. So appropriate support for mental health issues for learners is available in my school. We had 63 saying yes, 37 saying no. Incorporate activities related to mental health and well-being in my lessons. 88 said yes, and 12 said no. I can refer learners affected by mental health and psychosocial issues for further support. 90% said yes, and 10% said no. We can move. Okay, so here is another slide where our teachers in the last 30 days were able to indicate whether how often they felt and whether they were absent and things like that. But how they felt, this is what came through. Time, tired for no good reason, we had about 36% saying they were tired for no reason in the last 30 days of when this survey was conducted. And others, we also had those that felt lonely, about 50% said they never felt lonely. And we also had 41 who said sometimes, and those about 9% who said most of the times. Restless, we also had those. 55 said never. We had 37 that said sometimes, and the orange 88% said most of the times. And this goes on. These are some of the responses that we got on how teachers felt during a period of 30 days when this survey was being conducted. We can move.
Simon, let's try to wrap up quickly, please. We're running a little bit behind time. Thank you.
All right. Level of feeling tired for no good reason across various subgroups of teachers. This gave us a picture that was a bit gloomy and worrisome, and calls for a quick intervention by our policymakers and school managers in Zambia. I want us to move to the next slide. Thank you. Thank you so much.
Simon, thank you for that. And we know that you came in quickly to fill a gap, so we appreciate your time and your efforts. Quite interesting results. It was so interesting to see how many teachers faced those challenges, but still many would still pick teaching as a profession, and that number was higher for female teachers and school leaders. Quite interesting results, and I think that the participants will have questions about what you've said. We're moving on now to the last presentation for today, and then we'll have a Q&A after that. I'd like to call on Dr. Lawrence Sarpong. He's the the Deputy Registrar of the National Teaching Council of Ghana, to go over a case study of teacher well-being results in his country. Over to you, Dr. Lawrence.
Thank you very much. As Friday said, I am Dr. Lawrence Sarpong, but not the Deputy Registrar. I am the Director in charge of higher education at the moment. Thank you very much. So Ghana, we also had similar survey, and it's ongoing, but we want to share what we've gathered so far. Next slide. So we also collected the background characteristics of the participants, and currently we are having 1,456 respondents. If you look at the charts, the first data, we sample data on the rows of the participants, and we have more classroom teachers than the other areas. Then the type of school, as you can see on the screen, the public school teachers are more than the private school teachers. In terms of location, we have rural and remote areas dominating, followed by semi-urban and then urban. School level, we have the primary 51%, secondary 42.4%, and then pre-primary 6.5%. In terms of sex, we have the males dominating the female. We also have age group with 25 to 35 years and 36 to 45 years dominating. And teachers who were absent, we collected data on teachers who were absent between 0 to 4 or more days. And the respondents, we have larger number of teachers who did not absent themselves from class, close to about 70.4%. The next slide. We also, the background characteristics continue. And here we look at how the plans that teachers have elsewhere. And we notice that about 53.2% of the teachers indicated that they will continue to be at work as teachers, with 24.5% saying that they move to administration, 13.1% will leave the education profession to seek other career elsewhere, with 5.8% indicating that they will leave the education profession and start their own business. 3.5% who had about 5 years to go on retirement indicate that they will still be on the job. We also collected data on the class size that teachers are managing. And the results are there. 27.5% of the teachers had their class size above 54. Then 18.3% had their class size between 45 and 54. With 40.3% indicate that their class size is less than 25. We have number of lessons per week. And as you can see on the chart, about 10.9% indicate that they had more than 36 lessons a week, with 11.5% indicate that they had less than 10% in a week. So the class size range between 11.5% indicate that they have less than 10 lessons in a week, and above 36 lessons a week, we had about 10.9%. The next slide. Now the issues. Data on teacher job satisfaction. We use the Likert scale that ranges from strongly agree to disagree, as was presented by my colleague from Zambia. The variables were similar, but in terms of the results, we have only 1 in every 5 teachers, that's 20% of the teachers interviewed, that indicate that they were happy with their job compensation. 20% were happy with their job compensation. That notwithstanding, 55% of the respondents indicate that they are highly satisfied with their job. So in as much as 20%, only 20% were happy with a job compensation, we have 55%, more than half, indicate that they are highly satisfied with their job, which is a paradoxical. Let's go to the next slide. Next slide, please. Thank you. So here too, I'm highly satisfied by my teaching job. We look at it in terms of the position, sex, school level, and school location. And as you can see on the screen, the red mark and then the teacher sex, we have female teachers constitute about 62%, indicated that they are highly satisfied with their teaching job. Their male counterpart, 52% were satisfied with their teaching job. We also have head teachers, 58%, indicating that they are highly satisfied with the teaching job. And when it comes to the school level, we have primary and pre-primary. That's 60 against 66. So in all, we have female teachers indicating that they are satisfied with their job, and the pre-primary and primary teachers, as well as the head teachers, also indicate that they are satisfied with their job. So the level of job satisfaction were slightly better among female teachers, pre-primary teachers, primary teachers, and heads of schools. The next slide. We wanted to determine the predictors of job satisfaction. And as my colleague explained earlier on, in our case, the variable that came out as a predictor for job satisfaction, we have, after going through using the beta and significant values analysis, the factors that came out are teacher age, travel distance, years of experience, class size, career plans, compensation, promotion guidelines, and then teaching, making life meaningful, as well as career choice. These are the predictors of job satisfaction per the beta and significant values, that analysis that we did. The next slide. Now, the teacher well-being. Here too, we'll look at the mechanisms that are available to support teacher well-being. So we have variables like written guidelines, whether they are available, or mental health and well-being at the school level, whether there were free training, whether there were referral when the need arises, in the state where there are severe cases, and then whether there was a common room for relaxation and socialization, professional services such as counselors available, and here we have either available or not available. And per the figures, you can see that the availability of support mechanism to teachers on issues related to mental health and well-being seem to be low among the teachers that the data were collected on. So in Ghana, the support mechanism is very low per the data that we have. Next slide. So here we are using the strategies that that teachers use to avoid work-related stress. In other words, how they are able to develop strategy to cope with work-related stress. We have whether they seek professional support to help untangle their life challenges, whether they make time to relax by going through exercises and others, whether they're able to reach out to people close to them, especially family members and friends, setting clear boundaries between work and non-work matters, making sure they are eating healthy diets, among others. And when you look at the figures that we have, you agree with me that where we have the amber color indicating never or rarely, then we have the light green indicating sometimes, with green most or all the time. If you do the computation analysis, you see that about 4 teachers in every 10 teachers reported not seeking professional support to deal with their work-related stress. Less than half, which also call for concern. The next slide. Level of participation in-service courses on mental health and psychosocial well-being for teachers. We have yes and no to this item, and the yes is indicated by the yellow mark, which form 32%, of the entire population. This also shows that 1/3 of the teachers reported participating in in-service courses. And if it's 32% of teachers that participated in service training regarding mental health and psychosocial well-being within the last 3 years, it also calls for concern to us as regulators and teacher management bodies in Ghana. The next slide. Support to learner mental health issues. We are finding out how they support learner mental health issues. And we have strongly agree or agree, and then strongly disagree or disagree. So appropriate support for mental health issues for learners is available in my school. Only 31% said yes. I incorporate activities related to mental health and well-being in my lessons. We have 79% indicated affirmative. I can refer learners affected by mental health and psychosocial issues for further support. 81% indicated that they do. Looking at this, it means that only 1/3 of teachers reported having available and appropriate mental health support for learners in their schools. 31, that's 1/3 of teachers indicated that they have mental health support system in their school for their teachers, their learners. This is also less than half, 1/3. It also calls for concern to us as teacher managers and education managers in the country. The next slide. As teacher, in the last 30 days, how often did you feel that lonely, wordless, so sad, that nothing could cheer you up, that everything challenges you, depressed and others? So there were a number of variables here that the teachers were also to indicate their state of being. And green, that deep green means never or rarely. Light green sometimes. Then we have the amber most or all the time. But per extrapolation, you see that the levels of possible teacher distress symptoms were generally low. Looking at the figures that we have, the fiscal indicators were generally low. The next slide. Again, here we are looking at the levels of feeling tired for no good reason across various subgroups of teachers. Remember, we have teachers ranging from the position, in terms of position, sex, segregation. We look at the gender, we look at age range, then we look at school location. But the determinants largely fell on the school level and school location. So level of feeling tired were marginally higher among teachers in urban areas and those teaching in senior high schools. Maybe the qualitative data that will give us further explanation to why those in the senior high schools and those in urban areas are feeling tired compared to the others. Let's move to the next slide. Here we ask teachers to rate their level of importance of the following factors that influence teacher decisions to stay in the job. If they want to stay in the job, what are some of the factors that constitute that? And we have ranked them. If you look at the ranking, we have 1 up to 15. And the job security, most of the teachers want to stay on the job because they feel secure more than going to any other places. Then opportunity for them to also develop themselves professionally, also ranked 2nd. Career progression ranked 3rd. And then some also believe that school leadership is available to them as they go through the rank and file of the profession. they one day rise to become school leaders. So the rankings are there, but we pick few of them: job security, CPD opportunities, career progression, and school leadership opportunities. These are some of the things, determinants, that will motivate teachers to stay on the job. Next slide. Thank you very much. I'm done.
Lawrence, thank you so much for that. Very interesting results, very interesting topic. I think without any further ado, we'll move quickly to our question and answer session. We have a lot of great questions that have been coming through and comments as well. So I'd like to call on Camelia, my colleague from UNESCO ICPA, to lead us through this next dynamic part of the webinar. Thanks.
Thank you very much, Marianne, and thank you to all the speakers for your excellent presentation. And we have received many questions in the chat and also in the Q&A. And thank you for participants to submit all your thoughts and comments and questions. So I would like to ask first Lawrence and Simon, as we see like these are concrete examples of survey results as we learned more about teacher well-being. We want to know like how have the results been influencing or in directing the policy making in terms of teacher mental health. Simon, would you like to go first? The question is, how has the survey results been used in indicating policy towards teacher mental health issues? Or Lawrence, would you like to take it first?
Thank you very much. Yes, so in terms of the result that we have, it has given us insight on the areas to consider in developing policy for teacher well-being and mental health issues. So we've seen some of the areas that we have to consider, but we are now going to develop the policy. And this study is critical to us to know the determinant factors, the areas that we consider. Even in terms of recruitment, the National Teaching Council of Ghana, we don't recruit teachers directly, but we provide framework upon which teachers will be recruited. So this also giving us an idea on how to design fit to teach strategies to screen teachers, because now we can tell whether some of these teachers acquired issues related to mental health before entering the job, or they acquired it after recruitment. So we need to come out with clear guidelines to know the teacher status, and we have to keep on screening them to provide immediate support to them if we detect any mental health issues. Thank you.
Thank you very much, Lawrence. Simon, would you like to comment on the situation in Zambia towards this? Yes, I'm gonna unmute. Yes, Simon, you're now
Thank you so much.
unmuted.
Thank you so much. I think for Zambia is this study happened at a time the process of developing the teacher comprehensive policy had commenced. And so what we are doing is just to try and input in the document that is being developed, so that some of the findings that were observed from the survey could be taken into account as we develop a teacher comprehensive policy document that shall inform the development of other documents and implementation. So right now we are kind of validating at technical committee level the document that has been drafted. And we hope that going forward, it will inform a number of other interventions that are going to follow. I thank you.
Thank you very much, Simon. And we have the great hope that these survey results can help improve the situation for teachers in terms of mental health. The next question will be to Luca. So, in terms of psychological support for teachers, are there any resources ready in the pipeline for teachers who are affected by health issues of learners in schools? There are a lot of teachers are not psychologically and mentally supported. So, Luca, could you introduce us to some of the resources available?
Thank you very much, Camelia, and thank you for the question. Yes, indeed, there are already a number of resources that are available that teachers can use to address mental health and psychosocial support for themselves and also for the learners. On our part as UNESCO and IGBA, working with partners, we actually developed a regional training guide on mental health and psychosocial support to be able to train teachers on the key competencies that would enable them to provide themselves with self-care support as well as to support their peers. So a number of countries have participated. We piloted the training in some Anglophone countries, 5 of them, Malawi, Uganda, Kenya, Zambia, Ethiopia, and then we've had in Francophone countries, we've had Cote d'Ivoire, Madagascar, also undertaking those courses and the training. And we are working now on rolling out, ensuring that the course will be available online. So give us 2 months' time. By August, the target, it should be up and running so that you have better access to the course. Other than that, we also have, we are putting together a list of resources on mental health and psychosocial support that countries can rely on as we now look forward to rolling out the AU Continental strategy on mental health and psychosocial support. So the focus will be on us supporting countries to be able to implement the strategy. And this also includes coming up with tools at regional level that countries can use and adapt for effective program implementation. Thank you.
Thank you very much, Luca, and thank you for pointing us to all the available resources or that will be made available soon. And from IGBA, we'll definitely make an announcement once these resources become available for the teacher educators and government for use. Our next question will be directed to Quentin and Sophia regarding CESA. So, one key strategy for country-level ownership and implementation is aligning CESA strategic areas and objectives with country-specific teacher policies. To what extent will the monitoring framework in the new CESA track the development and implementation of inclusive teacher policies through the appropriate reporting and knowledge sharing platforms? Quentin and Sophia, would you like to comment on that?
Sophia, you want to go first or you want me to go first?
Sorry, Quentin. Thank you for the question. Let me go briefly on that one with regard to monitoring and evaluation. Yes, not so long ago, we gathered the technical working group to come up with the implementation plan for CESA. And we will be sending that one to member state and also do some kind of engagement on how the document will be implemented. However, when it comes to monitoring and evaluation, we expect member states always to provide us with feedback. As the African Union, really, we don't have the mandate to monitor the implementation in member states specifically. But what we do is we expect that member state implement and monitor and give us feedback on those specific indicators that they are supposed to monitor, on those specific indicators that they are supposed to report on. But just as Quentin has presented earlier in this webinar, that most of the countries, when it comes to CESA knowledge and the awareness of CESA, really, most of the countries, they didn't know, and it is also impacting the implementation, because if they are not aware of the document, how will be they able to implement it? So what we are trying to do at our level at the African Union is to advocate more advocacy, to see to it that the document is being referenced, the document is being implemented, and it is also aligned to national plans in member countries. And that is when now we will be able to track those indicators that they are supposed to report on. Okay. Quentin, you can go ahead.
Right. So maybe I would add one thing, because to me, there are two levels of monitoring in a way. There is what we could call the official monitoring with a number of indicators that will be chosen for following up on CESA, the new strategy. Some of those indicators are very similar to the ones that are in the SDG4 framework. And so, for example, UNESCO Institute of Statistics collects some of those data from countries. So that's the most important, that's the official way of monitoring what is being implemented. But I should add that there is also a way to monitor in the lighter way sometimes some of the key issues, and I'll give two examples. The first one is that at IGBA we collected data from about 26, 27 countries right now, and we should have a report in about 2 weeks, I hope, publicly available, at least in draft, on whether countries are implementing some of the African Union frameworks regarding the career stages for teachers, regarding the competencies that are associated with those career stages, regarding the professional development that teachers need to acquire those competencies, and then whether this actually matters for teacher promotion in countries, right? So this is not part of any of the SDG4 data collection, if you will, that might also help monitor the new CESA like it did for the previous CESA. But it's something that can be done, not every year, but every 4 or 5 years, to see if countries are making progress in having better structured careers and professional development opportunities for teachers. That's one example. And the other example I want to mention relates to the two presentations by our friends from Ghana and Zambia. The idea behind the teacher well-being survey that has been implemented in those two countries, and it's being implemented in a much larger number of countries now, but those were some of the pilots. The idea is to encourage ministries to do this, or teacher service commissions or teacher registrars, depends on the country, to do this every 2 or 3 years, or maybe every 4 years, so that they can try to track whether things are changing, things are improving. And while my first example was related to the first objective in the CESA 2635, that example is related to the second objective for teachers in the strategy, which is the attractiveness of the profession, right? And there are other things we can do, like monitoring salaries, seeing how they evolve, whether teachers are paid too low or not, depending on the country. Those indicators are not part of the SDG4 frameworks typically, but they're actually feasible to collect. And the hope is that it doesn't have to be done every year, but every few years this can be done to see whether there's progress at the country level towards some of the objectives stated in CESA, in line with the African Union frameworks in those areas. So let me stop here.
Thank you very much, Quentin. And also, I have some interest from participants in participating in that survey. Would that be possible? That would be a quick one. Yeah.
Yes, I mean, so the survey of teacher well-being, if you are from a ministry or a teacher service commission or a teacher registrar or a teacher council or a teacher union, the main union in the country, for example, send us an email. Maybe put your name and your interest and your email in the chat, and we'll get back to you. Right. Right now, we have implemented the survey, I think, in about 15, 16 countries. Still going on in many of the countries. For 6 countries, we have enough data, so we closed it. Zambia and Ghana were the case. But we are very happy to do that with you. And the cost of this is zero, right? 0.000, right? So there's no cost. Essentially, we put the survey online. Then the ministry or the Teacher Service Commission or whomever is the counterpart shares it with the teachers, and IGBA will do an analysis that will go to the ministry or the Teacher Service Commission for feedback before we put anything out. But the idea is that if we have more countries participating, we'll get better data, something more representative, because things are not the same in all the countries. But it can also provide some insights, as both our friend from Zambia and Ghana said, in terms of the broader policy framework that is going on in the countries. So just put your name in the chat, your email, and we'll get back to you. Thank you.
Thank you very much, Quentin. I believe the Q&A session's time is up, and I hope the answers from our speakers could somewhat answer your concerns or questions regarding mental health. I'll give the floor.
Can I say one more thing, Camelia, before you give it to closing? I know we didn't have a lot of time for Q&A, and I'm sorry about that. But we are taking notes of your questions, and we'll pay specific attention to them when we create what we call the knowledge kits, which I think either Marianne or Clarisse might mention. All the presentations will be made available, etc. But then after each series of 3 webinars, we also create something a bit more ambitious, which is a summary of the 3 webinars with a lot of resources. And we'll pay special attention to your questions. So even if we didn't answer here, we'll find a way to answer in the additional materials we send you later. Sorry, Camelia, I talked too much. Back to you.
Thank you, Quentin. I'll just give the floor to Marianne for the closing now.
Thank you, Camelia, for that. And thank you, Quentin, for the reminder about the knowledge kit, which I will mention at the very end. I'd like to ask one of our national partners now, Dr. Clarisse Ojam, to give some closing reflections on her experience tuning in today to the new CESA strategy and the mental health psychosocial support strategy. Dr. Clarisse Ojam is our focal point for the GPE Kicks Hub project at the Federal Ministry of Education in Nigeria. And she serves there as the Deputy Director of the Department of Educational Planning, Research, and Development. Dr. Clarisse, could you come unmute yourself, turn on your camera for a moment, and share anything that has stayed with you after hearing the presentations today?
Right. Thank you very much. And a great job done by all the presenters, especially the committees and the CESA clusters. It was actually a very comprehensive document. The new CESA is built on the old, it's an improvement on the old CESA, looking at the old CESA, looking at the presentation, though time did not allow us to look at the new CESA comprehensively, but I'm sure that by the time it's made available, we'll all agree that it's an improvement on the old one. I am glad to observe that many organizations are focused on teacher education, teacher development, teacher professionalism in Africa. That will help us to get it right with, because if we get it right with quality teachers, we will have the type of education we need for all-round development in Africa. More so, we will meet the requirements from international protocols like SDG, AU, and all that. I agree with Sophia and the saying that education thrives when teachers thrive. In Nigeria, we say, no teacher, no nation. Teachers are very, very important. And if we actually get quality teachers, we are sure of quality education and then the education that we need in Africa. The presentations were very comprehensive. Dr. Wooden presenting the new CESA, gave us so many strategic areas, the objectives. He talked about the extensive consultation process, which is very, very good because there will be a buy-in when stakeholders are involved in forming a policy or making a program. So that extensive consultation process was very good. He talked about the detailed CESA review, the key conclusions, and then gave brief investment case, a guidance document, and he also mentioned something very interesting. He said a smaller number of objectives. Unlike probably the old CESA had a lot of objectives, and when we have the objective in small number, it will be easy to implement. It will be easy to measure the outcome, the impact. Monitoring and evaluation will also be easily done. And so that was very, very nice. It also talked about a stronger emphasis on teachers. And I mentioned before that if we get it right with teachers, we will solve a lot of problems. The problem of a poor foundational literacy and numeracy will be solved, and a lot will also be solved. It is heartwarming to note that the new CESA is also emphasizing on out-of-school children and lifelong learning. It gladdens my heart to know, because in Africa we have a large number of out-of-school children, and though they are very, very vulnerable to crimes and criminalities. So if we could have them arrested at that point, by arresting them is by getting them back to school, is going to help us. And not just getting them back to school, but to make them to learn, to also learn skills. Very, very important. And I'm very glad that the document have all those, and even the implementation structure. And you also mentioned that we have the M&E is a simpler way to, is simpler than the previous ones. I think that this new CESA document is actually going to be very impactful, so we need to actually follow it up. And then when Lucas was talking about Continental strategy on health, on mental health and psychosocial support for teachers in Africa, I think also that is very, very, very important, because teachers in Africa are really suffering. They are going through some mental fatigue that cannot be measured. Their welfare is not encouraging. Their well-being, they are not supported to the extent that when you want to place a course on somebody, you say you will be a teacher. It's a course. People see it as a course. But when you say, oh, when you ask children what do you want to be when you grow up, they want to be doctors, they want to be lawyers, they want to be this and that. But for a teacher, they will look at it as being that you're insulting them. So the inclusion of this is very, very, very important, and I'm happy about the inclusion of mental health for teachers. The presentation, the survey results from Zambia and Ghana underscores the importance of including it, not just having it as a course, but making sure that it's integrated in the programs and the curricula in teacher training institutions. So they will not just have it as a course. Each country should please ensure that it is integrated. Like in Nigeria, we are having this. It's included in our policy for national teacher education policy, which we have reviewed, and we are ensuring that this and others are included in the teacher education program, so that you'll start from the beginning. You'll start from the institution, the teacher institution, to introduce it, and that will go a long way. There is also need for M&E by all countries. I will not overflog it because it has been done. It has been said earlier than this. So for this CESA document, I think it's going to be a masterpiece. And for it to be a masterpiece and adopted by everybody, there will be need for a lot of publicity. Just like I think it was Sophia that mentioned that the previous one was not really very popular, so implementation was very, but for every country to accept it and implement it, there is need to really publicize it. We need to use digital and online social media campaign websites. I know that IGBA KISS is very, very good at that. We also need some traditional media like radio, television, newspaper. We should organize community engagement, workshops, town hall fora, use posters, use national dialogue, advocacy, sensitization to make sure that it gets down to the grassroots, because it's a very important document. There is also need for partnership with civil society organizations, NGOs, to make sure that we get this down. So I will stop here, and thank you very much for this opportunity. Thank you so much.
Thank you so much, Clarice. And now we can see you. Thank you so much for that. I think it was an excellent reflection and an excellent conclusion. I'm taking away something from what you've said. No teacher, no nation. No teacher, no nation. And it reminds me of something in Lucas's slide. Lucas Halimana from UNESCO ICPA had a slide that he didn't get to share. It said, teachers' well-being is the foundation of learning. Teachers' well-being is the foundation for all learning. And it's a reminder that teachers' working conditions are students' learning conditions, the direct link. And then hopefully if we focus on that, we can move away from teaching as the profession of last choice to one that is valued by society and governments and compensated accordingly. And so today we have heard about the strategies. Thank you so much to all of our speakers representing the organizations that are behind this Africa Teachers webinar series. I want to thank you, Mervi, Sophia, Quinton, Lucas, Simon, Lawrence, Camelia for the question and answers, and Clarice for the closing comments. Your organizations are a key part of the Africa Teachers webinar series. We are partnering with the EU RTIA. It's organized by UNESCO ICPA, but with partnership from the EU RTIA and from GPE KICS. And today we heard from the African Union, the Teaching Council of Zambia, and the National Teaching Council of Ghana, and from the Federal Ministry of Education in Nigeria. And we invite you back, and we invite all of you back to the next two webinars in this series. We'll be focusing again on teachers. Yes, here's the flyer for it. So we invite you back on July 3rd and on August 7th to continue the discussion. And I want to remind you again that if you attend all three of these in this series, you will get a digital certificate of participation, but you do have to attend for the full sessions. We want to make sure that you're really able to engage with us. I want to draw your attention to a few resources before we leave, and I'll post the links in the chat box. We'd like to remind you that we have some documents and some web pages that you might find useful to your work. We have the Africa Education Knowledge Platform. It's on UNESCO ICPA's website. And we have webinars, recordings, and PowerPoint slides from, well, it'll be from today, as well as the previous sessions, an announcement about the future sessions, also on our website. We will have the knowledge kit that Quinton mentioned soon on our website as well with the link. But you might want to take note of the main website. I'll put it in the chat box. Also on our website, UNESCO ICPA's website, we have a page for the GPE KICS Hub project, as well as our digital repository of resources from the country level and from GPE KICS, such as the Teacher Development Synthesis Report. And we invite you to please take the survey as well that Camelia mentioned in the chat box. It'll help us to improve the next sessions. And again, we'll hope to see you on July 3rd and August 7th. And we thank you so much for joining. And if we could take a group picture, that would be nice, Camelia. What do you think for our article? Okay, could we turn on our cameras just for a moment, please? There's everybody. Okay. Okay, I'll take the picture. Here. One. Okay. 1, 2, 3.
We are here.
Let's try to get one more. There's so many people.
Thank you. Thank you.
1,
Bye.
2, 3.
Thank you. Thank you.
So many
All right.
people. Thank you so much,
Bye.
everyone.
Thanks, Marianne. Thanks, everybody.
Thank you, Quentin.
Thank you,
Thank you.
everyone.
Bye-bye.
Thank you.
Bye,
I
everyone.
would
Bye,
like to
Mariam.
join you. Thank you, and see you next time. Okay,
Bye-bye.
we keep in
Bye,
touch.
Miriam. Bye.
Bye. See you next time.
Bye.
Thank you. Thank you.
Bye.
Bye.
Thank you so much.
Bye.
Have a nice
Bye
day.
to all.
Thank you.
Okay, bye to all. So we keep in touch. I know.
Bye, everyone.
So
Have a nice day, bye.
we are glad to join you.